Hi, it's Dr. Lane Smith from the Smith Plastic Surgery Institute here in Las Vegas. Again, I'm one of the busiest plastic surgeons in the United States. And today we're going to talk to you about rhinoplasty. This is one of the most common plastic surgery procedures in the United States, if not the most commonly requested procedure. Again, why? Because this can really change your life. And as always, we're going to show you a surgery.
Welcome to the Smith Plastic Surgery YouTube channel, where we post videos regarding plastic surgery, beauty, and skincare. We are one of the busiest plastic surgery practices in the United States. If you like what you see, please like and subscribe to our channel, or visit our website at smithsurgery.com to learn more about our practice and see more before and after pictures.
As I mentioned, rhinoplasty surgery has at times been the most common cosmetic surgery procedure in the United States, depending on the year that you look at it. Most recently, it's been increasing in popularity. And why is that? Because the nose is the center of the face. And often you'll see a very beautiful young woman or a handsome man. They'll have a really wonderful face and then a very ugly nose right in the center of their face. And it really detracts from the appearance. So rhinoplasty surgery can change an entire facial appearance and really just make a person look so much better. Today we're going to show you, as always, I'm going to show you a surgery today. This is a 2-hour surgery condensed down in about 3 to 5 minutes. This is a really horrible nose. It's a very big nose with a very big bump, very large bulbous tip, very uneven. And we're going to show you how we handle this surgery, again, in a kind of a condensed version. We don't show every step, and the surgery is a little more difficult than we show you, but I hope you're interested in seeing this surgery. If you don't like watching surgery, please don't watch this video. It's not for you. Just skip through it or don't watch it. But if you're not squeamish, we're going to show you a rhinoplasty surgery, a very difficult rhinoplasty surgery, and you can see the results right on the table. Hi, this is Dr. Smith. We're going to show you another rhinoplasty again today. We're going to show you a rhinoplasty again just because it's horrible. You see how bulbous her nose is, how it's flat, how there's a bump in it, and we're going to make it much better. So we made an incision here, and we're just lifting the skin off the nose so we can see what's underneath and start working on it. Hi, so we've lifted this off, and you can see these are the lower lateral cartilages. See these big cartilages, and that's why she has a bulbous tip. She has very big cartilages here, and we're going to have to trim those down. She also has a bump, so I've made a little tunnel here, and I'm just going to shave it down, kind of like you do, almost like a piece of wood that you're smoothing out. I'm just going to shave it down a little bit because we don't want to take this down too much. Now we've rasped down the hump, we've smoothed down the bump, and we're going to trim these lower lateral cartilages with what's called a cephalic trim, and it's going to make the tip smaller. I've actually made an incision inside the nose, section a little bit, Brian, and I'm coming here along her nasal septum. That's the part that divides the nose into two cavities, and I'm going to take some of that cartilage there and help use it to build up her tip. Now we've made a cut here, and we're going to take this and kind of suspend it up on the end of the septum to rotate it up, and then we'll take that piece of cartilage that I harvested, I'll show you that in the next clip, and put it in between here to give support to the nasal tip. So here's the cartilage I got from inside the septum, okay? And I've put those other two pieces of cartilage up to rotate our tip cephalically, and I'm going to put this in between to give it strength. I'm also going to trim it and put a little tip graft out of it too. So here we are sewing that little piece of cartilage in there, okay? All right, and then he's going to cut this, and I'm going to put another little suture in there. Now we're going to sew this other little piece of cartilage in place right here. It's kind of delicate, like that. And come across here, but not go through the skin, so it's a little difficult, but we got it in place. Now I'm just going to sew it in place. Okay, so we're not nearly done yet, but you can see the tip's already looking narrower, and we've already tilted it up. Remember, it was tilting down, and the bump's already gone. So we've still got a lot to go, but you can see it slowly taking shape. So now you can see the tip is even narrower still. We put stitches in to narrow it, okay? Now I'm going to put this little tip graft for the final piece of the puzzle. I'm going to sew it right there to make the tip even narrower. Okay, so now we've got this tip graft or shield graft in place, and you can see the effect it has is to really narrow the tip. Look how narrow the tip is now. Remember, she had a really bulbous tip, now she has a narrow tip. A really cute tip. And it's straighter and narrower. This little tip complex here, and we're just sticking a little piece of fat on it just so it doesn't look jagged, so it looks smooth and pretty. Just closing the skin back with very tiny sutures. Honestly, people always worry about the scar, but you really don't see it. Honestly, it's so small and heals so well that you just don't see it. But you can see how much narrower her tip is, but she's still wide here. So we're gonna have to break these nose bones and straighten it out. And I'll do that as my last step. Now we're gonna cut the nose bones. You know, people call it break, but we're actually gonna cut them very precisely. And by cutting them precisely will cause them not to bruise as much, and they'll look way better. Okay, we're just slowly cutting these nose bones. All right. Okay, so we're all done. We've fractured it and straightened it. Okay, and you can see the tip is much narrower. It just looks way, 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 way cuter. And it changes her whole face. Now, the face is very cute. It used to be all nose. Now you see her pretty eyes and other things, and just much nicer looking, but still natural looking nose. Now we're gonna tape it up and put a cast on it, which we take off in a week. Okay. We've done her nose, and what we're gonna do is we're gonna suction out the submental fat here. So her whole life, her whole face is gonna change. It's gonna be much, much cuter. She's gonna have a much sharper jawline, this cute nose. It's gonna change her life. I'm just liposuctioning in the neck area, the submental area. This is one of the best places in the body to lipo. It really changes, you know, your appearance a lot. It's not a very quick and not a very tough recovery. You recover very quick, and it's a big bang for your buck. We're just finishing up the lipo here, and you can see the huge change in her neck as well. And this is going to give her a sharper jawline, which makes people look younger. So she's going to look younger, and you know, we're going to wrap this in a wrap that holds it tight, so the skin will stick up against her chin. We'll do this a little bit, but we're almost done here with this last bit. And then they're going to wrap her. We'll take the wrap off tomorrow. Thank you for watching. There's lots of before and after pictures on our website at smithsurgery.com.
So you've been able to see that surgery, and you can see right on the operating room table the miraculous changes to her nose. Very bulbous, very big, very unattractive nose, and when we finish, actually a nice, small, straight, attractive nose with a small tip. Rhinoplasty surgery is one of the most common surgeries I perform. As I mentioned, it is one of the most common cosmetic surgeries in the country, but it's also one that it's easy to mess up. So if you're looking for rhinoplasty surgery, make sure you look at the before and after photos of the surgeon that does them. I am board certified both in ear, nose, and throat and in plastic surgery, so that's a very good combination for rhinoplasty. So if you want a real expert in rhinoplasty surgery, often your best expert will be someone who is both board certified in plastic surgery and ear, nose, and throat surgery, also known as otolaryngology, head and neck surgery. And those two board certifications, when they're married together, as I have, make for a very good combination, because not only do we want the nose to look better, we also want it to breathe better. And if necessary, I'm always able to do a septoplasty or a little bit of turbinate or sinus work if I need to open up the nose, and that's with my ENT background. And then my plastic surgery background helps give me a very good aesthetic eye, so the two marry together for really nice results. In terms of the surgery, it doesn't have to be super painful. This patient will wear a cast for a week. You don't have to look beat up. Often our patients have very little to no bruising. If this is done well with very fine, very precise cuts, very precise chisels to break the bones, you don't get a lot of bleeding, so we don't have to pack the nose. Most of the pain that patients worry about with rhinoplasty surgery is associated with packing the nose. I almost never pack the nose. And so patients can come in, have this surgery. It's not super painful in my hands. The recovery is very quick, usually look good even after a week. It is important though to know that noses get better for a year. When we make the skeleton a little smaller underneath, the skin has to fall down on it, and then the skin has to tighten on it a little bit like shrink wrap or a little bit like cellophane. It has to kind of tighten down onto the bone, and so for this reason, noses tend to get a little better for a year. But about 80% of the improvement will be seen after the first week, and then you get about 20 to 30% more improvement over the year as the skin tightens down onto the new skeleton. I hope this surgery has been helpful. I hope you've enjoyed watching it. If you like the video, please like and subscribe. If you have a friend who's thinking about rhinoplasty, please share this video with them. If you have more questions, please leave them in the comments below, or if you'd like, just contact us at 702-838-2455, or on my website, smithsurgery.com. Thank you for watching.